So, welcome everybody. Let's get my stuff set up. Thanks, Linda, for taking over tonight. Linda was a bit keen. She rocked in at 7 a.m. this morning, but understand that she is from the UK, and when she booked, it was in UK time, and now she's in Australia, so it didn't translate. So she's super keen and ready to go. Okay. All right, Linda, I'll let you just take it away. Do your thing, okay, love?
Cute. That's it. So, welcome everybody. Thank you so much for turning up today to listen to me talk to you about FND. And, I've been a hypnotherapist a long time, and this thing about FND, I didn't really know very much about it. And suddenly, a few years ago, I started to get clients that used to come to see me, and they'd say, can you help me with FND? And I used to be a nurse. I should know what FND was, but I tell you what, the majority of nurses and the majority of doctors haven't got a clue. So you're going to be really well up there with knowing about FND today. So I'm going to do a PowerPoint presentation, and I'll stop every so often and ask if there's any questions and things. But if there's something really urgent that you want to ask me, just shout out because I don't want you to forget that question or something, and we not cover it in some way. So hopefully you're going to enjoy this presentation. I have done it a few different times in different sorts of ways. But what I'm going to do today is every time I do it, I do a little update on it, and I'm going to share my screen now. So can everybody see my screen? Yeah, great. Let me just
Yep,
move.
sure can.
Good, good, good. So we are going to talk about hypnotherapy for functional neurological disorder. And why should I be talking about it? Well, as I've mentioned, I've been doing hypnotherapy for an awful long time. Um, but the thing that really jumps out at me the most is the statistics behind this condition. So let me tell you something. Did you know that about 15 to 30% of people who attend neurological clinics have got symptoms of FND? And somebody called Stone says that 16% of patients attending neurological clinics meet the new criteria for FND. And as I mentioned, it's really poorly understood. So this is a huge number of clients that are going to see neurologists and they don't know what to do with them because there is no official treatment. Yes, there's things that you can do, but there is no drug that's going to stop FND. So this is how I got really interested in it because I think it's a huge market out there. And if you're looking for something a bit different, well, maybe this is what might interest you. So who am I? Well, I'm Linda Witchell, and I've been a hypnotherapist for over 18 years. It might even be 19 years. I keep saying 18 years, but I think it's probably nearer 19 now. I have my business in the UK. I did something a bit different that people don't normally do in the UK. I decided to buy this rundown shop with a big masonette above it, four-bedroom apartment, and I changed it into a hypnotherapy center. And it's very unusual for this to be on the high street because, unfortunately, in England, there's a lot of people that don't really show themselves as a hypnotherapist. But I did something different. And now I even get people that are on the bus that go click, click as they go past on the double-decker buses, trying to get information about me because it's all written all over the window, as you probably can see there. I'm a bit of an academic. I've got a master's degree in hypnosis research, medicine, and clinical practice. I've got a master's degree in psychology, and I've got a master's degree in interprofessional healthcare because I used to be a nurse. And recently, I've started writing books as well. So you can see I've got my finger into an awful lot of pies. But really, what I'm here for is to help people and to help people to move forward. Because as a nurse, I saw people come in and have operations, and yeah, they were happy. But there's always a percentage of people that are not happy in life. And, life is too short. We need to get on and love life. And that's what I want to help people to do. And I found FND, which I think is a big thing to help people in life. So today, what I'd like to do is describe to you the complexities of FND, to share my experiences. And I'm gonna give you a couple of case studies that the first couple of clients that came through to see me, but I've had an awful lot since. And in fact, I just had one that I spoke to this morning, who has got a very interesting symptom with FND because every few minutes she keeps coughing and she can't stop her arm coming up and coughing. So that's an interesting one. I'd also like to highlight the neurological links between hypnosis and FND and to discuss how hypnotherapy can help clients with FND. Um, so let's get on and say, well, what the hell is this thing called FND? Well, it's a condition that there's no other known neurological disease can explain. It's a little bit like IBS. Any of you do IBS here? Yeah. Yeah, love doing IBS, don't we? So it's a functional problem. So there's nothing wrong with the bowel with IBS, and it's the same with functional neurological disorder. There's nothing actually that they can find wrong with the brain or the neurology system or anything really, but they have these really unusual conditions. Now, for a long time, it was really hard for doctors to diagnose this. But when we recently got DSM-5, they started to put some criteria down, and it made it much easier for doctors to be able to describe exactly what this condition was. Um, and we know that it involves lots of motor and sensory functions. So things like people have seizures, they jump about, they say, like the lady who was coughing, who always puts her arm up and coughs all the time. They also have lots of sensory issues. So it could be to do with the hearing, it could be to do with touch, it could be to do with speech, all those things. But the thing is, it's so complex because every client is different. So it's not like an IBS client where you might have, alternating diarrhea, constipation, or you have constipation, or you have diarrhea. Yes, you may have many other symptoms that go with IBS, but at least we can see, a pattern with IBS. But unfortunately, with functional neurological disorder, it's very complex. And there's many people that you can't actually say immediately that's FND. So there's many different treatments that have been tried, and some of them have some success, some of them don't have any success. But the one area that is really upcoming now is hypnotherapy to help people with FND. So let's just say what these 7 criteria are to say that somebody has FND. So they could have weakness or paralysis. So I've seen people that can't walk. I've seen people with a weak arm or a weak leg. They may have abnormal movements, and quite a lot of them have these non-epileptic seizures. So it might start with an arm twitching or some sort of facial spasms, a little bit like Tourette's. In fact, some of them do have Tourette's. And then other people, it goes into a full-blown seizure where they collapse on the floor and they go unconscious. And it looks a bit like a usual epileptic seizure, but it's not. Um, so they may have some swallowing problems, speech problems. I've met a lot of people that have got slurring of the speech. I've mentioned seizures, attacks. Some people have anesthesia or sensory loss, so they can't feel their fingers, or there's part of their face they can't feel. And some people have other sensory symptoms. For example, I've got a man at the moment who has got problems with his eyes. He can't stop blinking because he says his eyes are too sensitive. So as you can see, we've got a list, it's a criteria, but it's a bit wishy-washy, and not everybody has everything off of that criteria, and not everybody will present in the same way. So let's start by saying, what's the cause of this condition? Well, nobody exactly knows, but many people, including myself, believe it's trauma related. And, I've spoken to some clients and said, well, have you had any traumas in the past? And they've said to me, uh, no, no, not really. But when I start to listen to them, it's almost like they have a pressure cooker. They have a job that has one pressure on top of the other, on top of the other, until boom, they get FND. So really, they do have mini traumas, stressors that trigger it off. But a lot of people say they don't have trauma. Some people do have trauma. It's interesting that some people present who have had a medical problem in the past, a medical intervention, let's say a traumatic birth, or somebody who's had an operation that's had lots of complications. Well, that's trauma, isn't it? Many people present with anxiety and depression, and it's almost like, well, what comes first, the chicken or the egg? So, do you get FND and then you get anxious and then you get depressed because you can't go to work and you've got these funny things going on? Or do you start with anxiety and depression and then end up with FND? Well, it could be either. Some people have some psychiatric disorders. I haven't really met too many of those people. Maybe it's because they haven't been referred to me. There's an interesting point here that some people are perfectionists. And I see it over and over again that they've got very, very high standards in their life, and they won't accept anything except 100%. But life isn't like that, is it? We can't all be 100% at everything. Some people, it may be to do with their social or their environmental factors. I'm going to talk to you about a case study a bit later on of a man who, where he was working, affected how he felt. And other people are have health seeking behaviors. So it may be they keep going to different doctors with all sorts of, um, you know, issues that the doctor can't really put their finger on. So these symptoms present from a neurological perspective. So we've got the non-epileptic seizures, sometimes the loss of consciousness, dissociation, dizziness, tics, cognitive problems. We've also got the psychological aspects. So it's terribly traumatic for them, and maybe they've experienced something traumatic, and then they get anxiety and depression. But there's also the biological aspects. So there are genetic traits. I mean, certainly when we look at things like anxiety and depression, but also sometimes there's other things that get picked up. But I don't really get so involved in that side of things. Any questions so far? Are you confused about this thing called FND? That yes, Fiona, if you'd like to unmute and just ask a question.
So have you had people coming to you that may have been misdiagnosed
Many
with
times.
uh, uh, um it's interesting because a lot of this comes back to my chronic fatigue diagnosis years ago.
Yeah. It's
Um
it's a little bit
yeah,
similar
and it was
to
easier to just go,
fibromyalgia, and yeah,
yeah,
yeah.
so it's easier just to say, send me. I
Mm,
took myself to a psychiatrist, and it was so much
mm,
easier for them to just go, you have major anxiety and you have reactive
Mm,
depression.
mm, mm.
But yeah, so
Yeah,
anyway, keep
a
going.
very
Sorry, thank
interesting
you.
point. Thank you. Let's move on. So, because it's been difficult to diagnose, historically, there's been huge number of different names given to it. When we go all the way back to, Freud's time or even Mesmer's time, it was called hysteria or it was called conversion. And you'll still hear the odd time it gets called that. But in modern day times, because they couldn't understand it properly, they would just give it a name related to what the presenting symptom was. So it could be psychogenic movement disorder, psychogenic seizures, non-epileptic attack disorder, functional movement disorder, functional limb weakness, dissociative neurological symptoms disorder. I mean, God, what a mouthful. Psychogenic non-epileptic seizures. I hear that still quite a lot. Stress seizures. Well, that's interesting because is it all related to stress? Pseudo-epileptic seizures, dissociative attacks, and pseudo seizures. Now, there's an awful lot of medical terms there. And the main reason I'm telling you this is because if you start reading articles, research papers, books on these types of things, you'll get it seen written in all these different names. But today we call it FND. So FND is the diagnosis with the all those criteria. Occasionally, it will also get called functional neurological symptoms disorder, but FND is easy, so let's stick to that. I've mentioned problems with diagnosing, so DSM-5, the doctor's Bible of helping them to meet criteria with clients to diagnose. That traditionally looks at somatic symptoms and other related disorders. Lots and lots of clients have neurological imaging, so fMRI scans, CT scans. I have a client at the moment in America who told me he was going for his 31st, 31 fMRI scans. That's just to me terrible. And this was over 4 years. Lots of people have all those sorts of neurophysical tests like EEGs, EMGs, lots of different ways of trying to measure what's going on in the brain. There is a physical test called the Hoover test, in which they can measure the weakness in a limb. And, they go through all this of getting rid of all these possible conditions, and then they come down to it's got to be FND. So I just want to highlight some of the neuroscience behind it, because what's happening is that we've got this multi-network brain disorder, and it's given alterations in brain circuitry. Now, I don't want to confuse anybody who doesn't know much about neuroscience, but there's different areas of the brain, like the salience and the limbic network systems, that emotionally process stuff that get involved. And then there's the sensory motor networks. So that changes executive functioning. So, in other words, they can't think straight. So that's why they get these cognitive problems. But the easiest way, if you have no neuroscience knowledge, is just to say this is like neuroplasticity. We're trying to retrain the brain, change the habits, the patterns that are going on, so that people can move forward and enjoy life again and stop all these awful symptoms. So when I first study something, I go into quite a lot of depth, and I started to look at, well, what's the difference between hypnosis and FND? Because there were so many similarities. Now, we know when we look at brain scans that, in hypnosis, it's the dorsolateral prefrontal cortex, the executive functioning part, the thinking part that gets involved. We know the amygdala gets involved as well, and the insula about your awareness, who you are, etc. We also know about the dorso-anterior cingulate area, which is for emotional evaluation. That's further back in the brain there. And we also know about the default mode network system that gets triggered as well, that focuses your attention. And then we also know that we light up posterior cingulate cortex when we actually look at brain scans with hypnosis. But look here at FND. Look at the similarities. We've got the dorsolateral prefrontal cortex, the executive functioning that changes. We've got altered or increased activity in the amygdala and the cingulate areas, the salient cortex network. We've got areas in the default network mode that light up and sensory motor areas. So I found that really interesting when I was looking at all this because, what we do with hypnosis seems to be very similar to what's going on with FND. So why wouldn't hypnosis help? So when we think about what are the treatment goals, the professionals want to reduce the symptoms and help the brain to function typically. That's what we all want, isn't it? But for clients, it's to help them to understand their issue, to help them cope with it, and to improve their quality of life. For me, when I see a client, I'd love just to say, no more FND. But, we don't say we cure, do we? So the current treatments for FND are cognitive behavioral therapy and ACT, acceptance and commitment therapy. Yes, there are some studies that say it helps. Well, particularly, I suppose, if you've got cognitive functional problems, yes, it might help. But it doesn't completely sort it out. Mindfulness has been used as well, and there are some papers that actually say, yes, in some instances, it's helped a bit. Relaxation, well, that's sort of common sense, really. If you've got tense muscles that are going into spasm, etc., then relaxation's going to be wonderful. And along with that, meditation and some medications. One of my clients at the moment has got so many antidepressants and painkillers. It's like he's got to carry a bag full of them. And sometimes they just keep on giving more and more medication because they don't know what else to do to help these people. Physio is really important, and occupational therapy, and that's why I believe it's good to always to work in a multidisciplinary team so that you're the hypnotist, you've got the doctor involved who's usually a neurologist, and there may also be some physiotherapy going on, because once limbs start to get weak, then we're not going to get the same functioning back. We want to keep the muscles strong and moving. There have been some studies done with transcranial magnetic stimulation. That's when they put these electrodes on the brain and send magnetic stimulation through. There's been some work done with virtual reality, but I don't really know very much about it, to be honest. And there's lots of different sort of self-help techniques that people may use. So, yeah, there's a lot of stuff going on. And of course, now there's hypnosis. So, who should actually help these people? Well, I think we should help as many as we can, but there are some things that I think really need to be thought about. And so there's first of all, there's the usual hypnotherapy contraindications. So, if somebody is in a psychotic state, I won't take them on. They need their psychosis needs to be sorted out before I would deal with them. We just mentioned the risks of misdiagnosis by medical professionals, and that's why I always get a referral letter from the doctor in charge of them to say, yes, this is FND, and yes, you can go ahead with hypnosis. sometimes there we like, any time that you're going to do any sort of regression work, if that's what you do, there's always a risk of false memories if you don't do it properly. And there's also a risk that you might not be competent enough as a hypnotherapist, because what are you going to do if your client suddenly has a seizure in front of you in the chair? If you've not been used to seeing someone have a seizure, it can be quite frightening, and you need to know what you're going to do about it. So just be aware that if you're going to go forward with helping people with FND, make sure that you feel confident and competent at different areas that you're going to be helping people with. So what do I do when I help people with somebody with FND? Well, I believe strongly in psychoeducation, making the education to the client's level so that they understand. And even, I'm just thinking of someone I've got at the moment. The man that has had all these different fMRI scans, he's still hunting for a cure. He's still going to different doctors and seeing different people because he thinks there's something that they can do. He hasn't realized that FND, there isn't anything wrong. And after all these scans, you would have thought that he would have twigged that by now, but he needed to be educated about what FND is, that it's a real thing. It's not imaginary in somebody's mind or anything. It's real, but it's not a condition that doctors would normally treat. So hypnotherapy starts, I believe, with the psychoeducation, and I will always have a 30-minute consult before I see the client to understand what's going on so that I can see, well, am I the best person for them? I'm not going to take on every single client if I don't think I can deal with them, but I'm finding the more and more that I get involved with FND and the more complex things I see, I am dealing with it, and I'm getting some pretty good results. So then we have to address the underlying trauma or the triggers that have started this FND. And it means that the client needs to be very safe because maybe they've been to so many different practitioners and they all say something different. And you just want to be there as that person that they can trust because they've had so many people that haven't been able to help them. So it's keeping them safe, addressing their underlying traumas or triggers, and then helping them to focus and particularly those that struggle with focusing, because sometimes they're like their heads are going different places, and you have to pull them back so that they start to listen to what you're saying and focus a bit more. I like to address some of the motor symptoms, the sensory symptoms. It depends what the client says is the issue. And so I might just use, hypnosis and some visualization, things like control room. I might use some dissociation techniques. For example, the rewind technique is a dissociation technique, but there's many others. I like to use some cognitive restructuring. So I use a lot of metaphors, storytelling, and there's positive suggestions. And then I might use memory consolidation and learning. So that's giving them a big boost with their confidence and their ego. Say one of the clients that I have at the moment, he used to be a barrister in the US in a very high position in law, and now he hasn't worked for 4 years. What a letdown for him. He was such a busy man, and now he's not. So we need to boost the confidence and help them to feel motivated to move forward, to feel positive for the future, and to help them to learn about their own bodies so that they can know what they can do with maybe some self-hypnosis, or even just listening to some of my audio recordings to help them to move forward. So any questions on that before I move on to the next bit? Because I know I do a lot of talking. Okay. Let me tell you about one of the first clients that I had. So this was a young lady. She was in her 20s and she had a learning disability. So she had the age of about a 10-year-old, and she also had some other physical problems. So she had some bowel problems and she was having bowel surgery. And her mother rang me first of all, and the mother said to me on the telephone, "Do you deal with FND?" And I went, "Well, I haven't done so far, but tell me more about it." And she told me the story about her daughter who'd been diagnosed with FND for several years. And every day, this daughter had multiple non-epileptic seizures. Now, because she had a learning disability, she went to a special college in which she used to do artwork and cooking and things like that, stuff that she really loved. But she couldn't go anymore because the teachers couldn't cope with these seizures all the time. And in the past, she'd had CBT, she'd had physiotherapy, occupational therapy at home, and mountains of antidepressants. But nothing helped her. And this mother was so desperate for me to see her. But I was just a little bit cautious because although I've been a hypnotherapist for a long time, if I don't know something, I'm not going to jump at taking that person on. So after many phone calls, she kept phoning me up all the time. I said, "Look, I'll take her on as long as she was under a psychiatrist, not a neurologist. Her psychiatrist would write me a letter and say, yes, she's got FND and I'm happy for you to go ahead and do some hypnosis." Well, the next thing I got was many, many emails from the mother of every single test that this girl had ever had. I knew all the brain scans, all the blood tests, everything. And then she said, the doctor doesn't like writing letters and he didn't want to write to me. So that was interesting. But eventually she had an appointment with the doctor, and the doctor did call me and did say, well, if you want to do it, you can do it. He wasn't really very positive at all. So I thought, well, this poor girl, her whole life is upside down. She couldn't do the only things in life that she loved, and that was going to college and doing all her cooking and her artwork and all this stuff with all her friends who got also got a learning disability. So the first step that I had to consider is that somebody with a learning disability, you don't speak to them the same that you would speak to somebody who is an adult who can comprehend everything you're saying. Now, luckily, because I used to be a nurse, I did a big national project looking at how to provide information to people who have disabilities. And so I had a lot of knowledge about how to speak to somebody with a learning disability like she had. And so my first step, like you would do with any client, was to be starting to build rapport with her, talk about things with her in a very simple language. And I always keep a flip chart in my office, and I draw pictures on there and things. And she loved that, and she wanted to draw pictures on the board as well. So the rapport was there very quickly. And so I'd never dealt with anyone with FND before. So I thought, well, how am I going to hypnotize this girl? So I just thought, well, I'll ask her to think of a nice place that she's been before and just shut her eyes while she's thinking about this nice place. So she shut her eyes and she told me she was going to think about when she went on holiday once. And so she took a few deep breaths, closed her eyes, and started to think about the holiday. And we were going for about good 5 minutes, and suddenly her right arm started to move. And she lifted it up, and her right arm was moving, and then her shoulder went, and then she had a seizure in the chair in front of me in my office. Now, because I used to be a nurse, it doesn't bother me with people with seizures, but I had to what I did. I just said, "You're absolutely safe. You're calm with me, and you're going back to that lovely place where you went on holiday," and the seizure stopped. So I just carried on talking. You know what it's like when you do hypnosis. You can't remember exactly what you say to people because I don't use any scripts. And said all the positive suggestions to her. Then I told her to open her eyes, and she was very happy. And off she went with her mum. And then I got an email the next day, no more seizures. The next day, no more seizures. And so then the girl was excited about going back to college. But unfortunately, she had a bowel problem. And the bowel problem was causing her a lot of pain, and she was on the waiting list to go into hospital to have an operation. And the pain was getting worse. And then when she came to see me, I think about the third session, she said, "Oh, I've got such bad tummy ache." And the seizures started coming back one by one. So then I had to work on the abdominal pain to help to get it in control so that the seizures will go down. And the seizures stopped completely for 3 weeks, but she still got the odd one or two because she was waiting for um, this operation. But I never did really find the cause of this girl's FND. But she did tell me once that she had a dark cloud behind her. And I asked her what the dark cloud was, and she said, "I'm too scared." And she wouldn't tell me what it was. And, maybe I could have done more sessions and done some content-free hypnosis. I don't know. But anyway, she left me, and I've never heard from her since. So how would you feel if someone had a seizure in sitting in the chair? Anybody want to say? Maybe somebody's had a client who's had a seizure in front of them. You have, Megan. Just unmute yourself. Just unmute yourself. We're not hearing you, Megan. Anyway, so you've had a client that's had a seizure. Anybody else?
Yeah, I had a client who had a stroke.
Had a stroke. Oh, right.
Yeah, because when he was sitting there, even though he was in hypnosis, he started to beat up like all sweaty.
Uh-huh.
And just being a volunteer for the SES, I was lucky that I've been in those situations before and I knew what to do.
Yeah.
And, I did wonder after that how many people that could happen to. And I saved his life because they're like, look, if you hadn't have like, rolled him over, kept his mouth open, kept talking to him, telling him to breathe and all that sort of stuff, he would have
Mm.
actually ended up in a much worse state. I mean, he had a
Yeah.
stroke,
Yeah.
so, he still didn't end up really good, but it could have
Mm.
been much
Mm.
worse.
Well, well done. I mean, the
Scary
we
stuff.
in the UK, I don't know if you do it here, but we all say fast. So everything has to be done quickly and get them to hospital, and
Yep.
if they need anticoagulants or whatever, everything needs to be done quickly. So
Yeah, and this guy
yeah,
was like probably 140, 150 kilos.
uh-huh,
And when he started to go beady, he opened his eyes. He said, I don't feel very well. And I
mm,
literally said to him, stay relaxed and calm. You're safe here. And as I
yeah,
said that, he stood up and I was like, oh, here we go, you know.
Yeah.
So I
Yeah.
knew how to grab him, to caress him to the floor, all
Yeah.
that sort of stuff. So it's
Yeah.
scary.
Yeah. It is scary. And, we just never know if we're going to get these things happen to us. So certainly having a seizure is scary. So let me move on to my second client. So my second client that I had with FND was a 32-year-old male. Um, he was married and he's an artist and he used to work full time. But now, when I saw him, he'd stopped working for about 2, 3 years, I think, several years. And his wife had to give up her job to become a full-time carer. And it was because he was having at least 10 seizures a day. And his seizures weren't just a bit of shaking like my first client's seizures. He would do a full-blown seizure in which he would go unconscious. And if he was standing up or not in a safe place, he would collapse on the floor. He also had difficulty focusing on things. He had memory problem. It's almost as though, he took a long time to think about things and definitely had brain fog. Couldn't make any usual everyday decisions about things. And he had this terrible, terrible fear of going out because, once you get these seizures, you worry that if you go on the bus, go on the train, go somewhere, that you're going to have a seizure there. And then what's going to happen? So he didn't go anywhere. Of course, he didn't move around very much because he was just sat in the chair all day. And he had terrible muscle weakness, struggled to walk, had balance issues, and again had anxiety and depression. But the interesting thing with this client is he really hated loud noises. And I couldn't, you probably noticed that I can speak quite loudly. I used to be a Toastmaster, so I can project my voice, yeah. But I had to calm it all down because he didn't like loud noises at all. And he spoke in a whisper, which was really difficult for me because it was all done online. And I had to speak in a calm voice as well. Um, Now, he had a definite history of trauma that triggered his FND. And it was a really strange sort of story because he was an artist and he'd moved to a new studio and he'd rented a big room somewhere in an industrial area, where they've got big factories and storage places. And he'd got this room and he got all his artwork there, and he did big paintings, the sort of murals that you'd have on the whole of a wall. He did big paintings, and so he needed a very big studio. And he was painting one night, and he often went, once he got into the flow of and the feel of the paint and what he was doing, he often would stay there late at night. And one night he was there till midnight. And suddenly there were, I think, what you would call here bikies, a big group of people on motorbikes going round and round and round his studio, shouting, throwing bricks and all sorts of awful things like that. And he got so frightened being there on his own. And that's quite soon after that is when he ended up with FND. So that was about, let's say, about three years before I actually saw him. Now, how did I treat this man? Well, because it was quite difficult for him to focus to start with, and because he had muscle weakness and tensions, I decided after the education to do some hypnotic relaxation. I also did some parts therapy, talking to the part of him that was frightened, to let go of that fear of what happened in his studio. I used quite a lot of anchoring to anchor, positive suggestions, and I did a lot of future pacing because he wanted to be internationally known artist. Now, because he was an artist, oh, it was so easy to use the right words with him because he was so visual. Everything was easy with him. But just like the first client, he did have a seizure about the second or third time that I hypnotized him. And because he had these big seizures and he often collapsed to the floor, I made the wife sit the other end of the room and she used to sit there doing knitting. So I knew she was there because I hear click, 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 click with the knitting needles as she sat the other end of the room. And sometimes when I got deep into hypnosis with him, then the knitting got a bit slower, as maybe she was slowing down as well with her knitting. But anyway, so I did a lot of future pacing. And there were significant improvements in his seizures. So he was having more than 10, and then it went down to only one or maybe two a day. And then he started going out and he went on the train to London. And when he was fine, he always had his wife with him, but he was fine. And this treatment didn't just help the client, but it was giving the wife hope because her life had also ended since he got FND because she didn't do anything else except for sit with him and look after him. But he got referred to a new psychiatrist who was dealing with looking at FND. And he thought that this psychiatrist was the one that was going to sort him out. So, although he went down to one or two seizures a day and there was significant improvement, he did not stay with me after, I think it was 5 sessions that I had with him because he wanted to go and see this new psychiatrist. So, you just have to honor what clients want, don't you? So, I mentioned about 5 sessions I had with him. The girl that I saw earlier, I probably only had 4 or 5 with her, not so many either. So how many sessions should I have? Well, because I'm a research evidence-based person, I like to go and look out there and say, well, what have other people done? Have they proven anything? Well, I couldn't really find very much because there isn't a lot of research on hypnosis and FND. But Tibbin in 2023 said 8 sessions are needed for hypnosis and catalepsy. I don't know why they said catalepsy. I think it was the way they induced hypnosis. So he said 8 sessions, but it wasn't very clear. But since then, there's been another really good paper by Connors et al. In 2024. And in 2024, they did a systematic review and they've looked at all the papers out there that are related to hypnosis. So if you want a potted version, instead of having to do too much, go and look at Connor's paper because it's all there for you. Now, I can't ever talk about clients without talking about or thinking about ethics because we all want to do good. There's no doubt about that. The beneficence, we all want to do good for clients. But you've also got to think about, could you be doing any harm to them inadvertently? So things like, they need also to be in this multidisciplinary team. You need to support them to see the other right people in the team that can help them. And you need to know when it's time for you to pull back or whether it's time for you to push more sessions with them. So someone I have at the moment's had 5 sessions. He's going to need at least another 5 sessions because he's so complex. It's like peeling back the onion of layer upon layer. And so I always just like to mention ethics because I think it's important. So what have we been talking about here? Well, hypnotherapy is a very valid tool to help people with FND. I believe it should be multi-agency, but it needs to be with doctors and people that really understand it and want to help the patient client with you, because there are so many doctors that do not understand it. And we're seeing an increase in number of FND patients that are being referred to hypnotherapists. You think with those original statistics that I said to you, 30% of people that go through a neurologist have got FND. Wow, that's a lot of clients, isn't it? But hypnotherapists must assess their ability to work with these clients and know their boundaries. Be prepared for unusual things. But like everything, we need more research. We need more people to continue to look at how we can help these people with these awful, awful conditions. So I've put you, you can have the slides, and there's lots of references here if you want to look it up further. But we've just got a few moments now if you'd like to ask me any questions. So you can just unmute yourself and you can just fire away, say what you want to say.
Hi, Linda.
Hi.
Can you hear me, Linda?
Yes, I can hear you.
Good. I'll be very frank, I had no idea what FND was until last Thursday, when I collapsed, and
Oh dear.
ended up in emergency. And it was described to me by a very beautiful and very compassionate emergency doctor as playing dead, and my version of it anyway. And so I basically just was sitting here doing some work, having a cup of tea, and I collapsed. And the whole world went into slow motion. There was no trigger, no trauma. Life was as usual, but everything went into slow motion and I just passed. I was gone. Carried to the bed, and then my eyes wouldn't open, wouldn't talk. And then I started having seizure. It just kept going and I kept smacking my head on things. And I found it quite interesting because I knew the entire time I was 100% there mentally. I could hear everything that was going on around me, but I couldn't respond. And so I found it quite fascinating when through the paramedics and through being in the hospital, etc. The only thing that kind of got me through all of that was self-hypnosis in that moment. And the fact that I did know, just keep talking to yourself, keep relaxing, just keep doing this, it'll all ease over. And the beautiful emergency doctor did say to me, there's nothing I can do for you. There's no test that's going to show anything. And so he was quite clued up on it, which I was actually really grateful for. But to be honest, last time I had a panic attack would have been when I was in year 12. And at no point have I ever seen this functional freeze version of the panic attack come across someone like myself, who's, I'm pretty fast in this world, get on with my stuff. No obvious trigger, just boom, gone within 60 seconds from being completely normal to out of it. Is that something you see? And I'm totally fine now, no symptoms, nothing. Is it something you see with your clients? It's just that there'll be a moment where it might happen once and then they go completely back to normal. Because what I'm hearing from you is it sounds like there's some symptoms that are very ongoing for you. But right now I have nothing that occurred in those moments.
Well, thank you so much for sharing your story with us. And, what an amazing tool we've got of hypnosis that you could actually deal with that yourself. So that's wonderful. I've not seen anyone who's only had one seizure and came out of it and sorted themselves out. So people come to me who have tried everything else and they've probably had years of different symptoms. So,
Okay.
yeah.
And it's interesting because they said to me, there's no, MRI, there's nothing we can do. It'll all come back blank. And I kind of knew it anyway. I knew from what was the feeling of what was going on, heart rate normal, pulse normal, everything was normal, other than I couldn't open my eyes to see them. But having said that, the paramedic stuck his nail into mine very, very viciously. He did warn me he was going to do it. And in that moment, everything came back. I could see, I sat up, I could talk. It only lasted a couple of seconds and then I was out again. but he was just checking to make sure I was in and that I wasn't having a stroke or anything like this at all. So I found that to be quite an interesting technique to use pain to induce me to get my ass back into the seat. I don't recommend it, but it worked. So yeah, for me, the hypnosis side of it had everything. You know, I was dismissed by 11 o'clock in the morning, and I was back doing my job at 8:30 the next day. So nothing was really lingering, other than I would be very honest to say I was a lot slower, but I had to present the next day, so nobody probably knew any difference anyway.
All I would say is make sure your stress levels don't go up too high in the future. But that's really interesting. Thank you. Anybody else got a
Thank
question
you
or
for
comment?
sharing, Tanya.
Yeah, that's good of you.
Linda,
I
can you be
worked.
born with it? Sorry, Luigi.
Can you be born with it? I've never known anybody being born with it, but children do get it.
I've got a case for you then.
Okay.
I had a client present with serotonin disorder, and they had seizures. They spoke with a different accent to their normal accent, and there was this distinct parallel between repressed trauma manifesting itself in these different types of behavioural change. Because they had been given too much serotonin in the hospital and it became a legal matter, their solicitor encouraged them to stop hypnosis. Even though with hypnosis they were able to stop taking Valium, they were being able to reduce the number of seizures, but it was really frustrating that a solicitor got involved with the actual therapy. But it was really interesting to remember some of my early days in hypnosis, rereading about Freud's visit to Salpêtrière with Charcot, and realizing that he missed the boat and could have done so much good if he just didn't let his ego run the show. And I wonder, do you think there are parallels between FND and things like serotonin disorder?
I think that there could be. I mean, if I don't know, I always go and look round first of all. So I can't answer it directly because I've never had anybody with any serotonin disorder. So there could be. That's my answer. Yeah, thank you. Anyone else like to say anything?
I just go up. Holy shit, that can answer so many questions and still raise questions all at the same time.
So what I like to say to people,
I've got a
oh, go on, Felicity. Yeah, you want to say something?
So have any of these clients that you've seen ever ended up with like twisted bowels and then ended up with because this lady was diagnosed that her brain would, and like say you cut yourself, it would send out, you know how you send out the message to, okay, we're going to send a clot there so we don't bleed out. Her brain kind of went like when your computer goes spazzy and it kind of went, right, we're going to send out multiple clots everywhere. And this lady had just one day kind of got this twisted bowel, but then when she got that first, she lost all movement in her arms and legs, and she could talk, but she just recently, she's a hair client of mine, and yeah, so she did kick a toe, cut it open, like willing, I don't know, in the wheelchair somehow, and her husband or something. And yeah, so that's what had happened to her. I'm just wondering if there's like kind of an extreme case, because they couldn't figure out what was wrong with her. They don't know why her brain was doing this. Like, they've
Mm.
tried to do physio with her on the twisted bowel to start with.
I've never heard of anyone having a twisted bowel without some other physical sort of reason. But just off the top of my head, I'm thinking, well, look at this gut-brain connection that we've got going on here. So there could be a connection with, why this person had a twisted bowel. But I think it's, with my nursing hat on, I would say it's more likely there's some physical thing there. But, I don't know.
I was just more curious about, why the brain decided to send, like, it put her into total freeze when she had the bowel thing happen. But, years later, and then she's cut a toe
Mm.
and it sent a clot, and then it just keeps sending clots everywhere.
We
I
don't
just found that part
understand a lot
interesting.
of things. We don't understand a lot of things, but the brain is so powerful. It can, sort things out if it's given the right help. That's all I can say.
Mm.
Thank you for that, Felicity. Any more for any more?
Yes, Linda, one of my thoughts is, and you mentioned it before, is to help the clients process the aftermath of what's happened. So for me, the only real concern I have with what had happened was, what if that had happened with the kids in the car? And I'm curious to know what your approach is then with how, in a hypnotic state, you're working with people to, because we don't know what is going to happen, but how are you working with them to, I guess, placate them in a way to soothe them through the process of the what ifs with regards to things like getting back in a car?
Well, the what if scenarios are crystal ball gazing, aren't they? We could say, what if this happens? What if that happens? There's risks around in life all the time. And all you can do is mitigate the risks and just get on with your life, because life has always got risks. You just got to look at the more positive side of things. And you can't pull yourself down by saying, oh my goodness, what if I'd been in the car at that time? Well, you weren't in the car at that time, so let's just move on. Yeah. That's the way I would look at it.
Thanks.
Yeah. But of course, if somebody who's having hypnosis feels safe, and you future pace, you progress to the future of that good life that they're going to have, hopefully they're not going to have all these negative thoughts going on about, oh, what would have happened if I'd had an accident when I had that seizure, or oh, what would have happened if I would have cut my head open and when I had that seizure. You could just keep playing lots of things to yourself all the time, couldn't you? But thanks for that. Aggie.
Hey, Linda.
Hi.
Children, you mentioned children.
Mm-hmm.
Are you finding an increase?
I personally do not market for children. Of course, I've seen many, many children over the years, but you'll probably see I'm old now, and I just cannot connect with kids in the same way that I used to. If I sit, because you've got to have that rapport with it, especially a fairly young child. You've got to have that rapport going with them so that you get their attention, if nothing else.
But they talk
And
in
I don't,
code these days and
Hmm?
lingos and stuff. Like,
Yeah, but I'm not good at all kids
yeah,
stuff.
like
So
my biggest code word when I was young was cool. And now they have these whole freaking dialogues. And you're like, dude, you didn't even say one actual word. You just gibbered bullshit for the last 20
I
minutes.
know,
Like,
I know. So I haven't seen any children with FND, but I do know FND occurs in children. I don't know of a hypnotist who deals with children with FND.
I was
So,
sent a girl referral, FND, 12 years old. And it's true that she did calm down through the session. And it's true that she calmed down even further with the second session, but I felt that her mother was very, very interfering. Her mother was talking all sorts of things to her and literally putting the anxiety back into her. So we stopped at the second session because I can't actually control what mum's going to do when they leave the session.
Did you have a talk with mum?
I tried to have a talk with mum and she was like this.
Oh, right. Well,
And
what else can you do?
sometimes you just got to leave it alone, right? Which is sad.
I find that with a lot of clients with because I have two special needs boys and I work with a lot of different people like that. And their motto is why the parents are half the problem is because they keep the kids sick, they keep the funding, they keep a lot of things happening. That means they've got denial, they've got a lot of other issues within themselves, and they don't want to see their child better. They don't want the child to succeed. It is a common theme across, doesn't matter what disability or what diagnosis in children. It is a huge, huge theme across a lot of them. If you can get the parents out, kids are completely different.
Yeah, well, mum wasn't in the session, but it's what happens after the session, right?
That's right. Yeah, that's the thing is taking the
A secondary gain.
Yeah, the secondary gain from it all. The parents gain so much from their child being so sick. And this is where I hit headlocks with a lot of organisations and that I don't want my children dependent on a system. I don't want my children dependent on everyone. I want them to thrive. And so I personally know what it's like because I actually had an OT tell my son he's going to rock up there every week just so they could keep the funding coming. And I'm there saying no, but that's what a lot of parents are doing. It's like they're playing the cycle of, oh, my child's this, my child's that. Let's keep the cycle going because there's a secondary gain for them out of it.
Unfortunately, that does happen everywhere in the world.
But thank you. I was just wondering how many kiddies you worked with.
Yeah, I don't. I mean, I do work generally, occasionally with children if somebody asks me to, but I don't market myself to see children.
Yeah.
I do see teenagers sometimes.
Well, 12's getting close to that.
Yeah, but I don't see children usually.
Yeah. But thank you. It's been an amazing presentation.
Thank you.
And
Anyone
guess what,
else?
Argie? You can talk to Linda at the Australian Hypnosis Conference.
Yes, I know.
She's going to be there.
I'm looking forward to it.
So you can hook into
We
her
seem
through,
to be crossing paths all the time lately. It's been
just
really
slide
good.
into the seat on the table where she's eating and just go, hey, blah, blah.
No, I'm always happy to pass on any knowledge or skills or anything that anybody wants. You know, at the end of the day, we're here to do good as a profession, and we want to raise the bar as hypnotherapists, and we want everybody to know that, you know, things like FND that the docs can't sort out, you know, we can. And so why shouldn't we talk about it more? Why shouldn't we, you know, raise the bar and let everybody know about it? But of course, we've also got to be aware of these hypnotherapists that are out there that are not very good, that have done, you know, a day's course or something ridiculous, and they're not, you know, keeping up to date with things like all of you are. So
And
yeah,
Linda's also a supervisor. So I've just
yeah.
put the link to the CHA website if you want to book with Linda and have a chat to her about stuff as well, because she's very well informed. Like she knows her shit. She's been around, you know, a little bit longer than me, that's for sure. So yeah, she knows her shit. And actually, you're raising a very good point there, Linda, as well, by saying, you know, these hypnos that, you know, blah blah blahs. Just in China, it was released just yesterday that any influencer in China that talks about anything financial, legal, education, and something else, there are 4 topics. If they don't have education in that area, as in a diploma, they're not allowed to talk about it on social media anymore. Otherwise, they will be
Wow.
fined. And now they have to submit their diploma as part of this is what I talk about. So, that's one of those catch-22 ones because I would love to see that introduced in Australia and see how many of these so-called egos are suddenly disappearing off the social platform because they don't have their diploma, they're not getting their supervision, and watch the quality of the industry actually lift, you know. So yeah, and stay tuned because Justine and I have some big news as well that we're releasing at Australian Hypnosis Conference because we hit a huge milestone today and we're hitting another huge one on Thursday as well. So, we are pushing not so much for legislation and stuff like that, but just for high quality training and education. And like Linda said, fucking talk about it. Say the weird stuff. Okay? Talk about it with each other and network. Grow together. Okay?
And also, talk about it with people who are not hypnotists
Mhm.
and prove that you know what you're talking about. And so you have to change your language according to who you're talking to. So if you're talking to a doctor, you make sure you've got some research behind you so that they know that you know what you're talking about. If you're talking to someone on the street, well, you're going to have to talk in a very layman's term, aren't you? So just let everybody know in the way that's going to suit them best. Yeah.
Thank you so much, Linda.
Okay.
Honestly, I just love listening to you. I really do. So thank you so much for talking to us here today. I will send out the replay tomorrow for everybody. Understand that we do have our conference coming up, so it might be a bit slow on the uptake. But yeah, we will get it out as quickly as possible. And if you have any questions, get Linda on as one of your
Yeah, email
supervisors
me.
or email her and
Yeah,
she'll help you
Linda at
out.
Awaken the Change.
Okay?
Yeah.
I think you could do a
Yeah.
better promo of that conference. You've only just let it slip in a little bit. You should actually say it.
I'll twirl my hair. I played 80 music before we started. I thought that might be enough.
No,
Yeah.
no,
So
tell everybody they've still got like how long to buy their tickets? And
You've got
Linda's going to be there.
24 hours, so you've literally got
yeah.
till midnight on the
Yeah.
31st. So yeah, that's a catering thing. So
But we're
yeah.
going to have a great time, aren't we?
Oh,
I'm
Oh,
looking
yeah.
forward
Yep.
to it. So I'm
have you got your
flying down.
80s? Have you got your 80s ghetto
Not
set up?
yet, not yet, because I've just moved house and I'm upside down. So yeah, I'm just gonna sort something out in the next couple of days. But yeah, I'm looking forward to it, and we'll all have a good old talk and yeah,
And a dance.
celebrate the fact we're all hypnotists.
Yeah,
Yeah.
eats too much food, World Hypnotism Day, all that stuff. So yeah,
Mm,
awesome. All right, lovelies,
yeah,
thank you so
yeah.
much. This is our last
Nice to
meetup
see
for the
you.
year.
Yeah.
And we have World Hypnotism Day coming up in January. I will send that link to you inside the replay. Please jump on that. We are going to be having Hypno Feud. So think of it like Family Feud, but hypnosis style. Okay. So it's going to be a great lot of fun. We're going to have heaps of prizes to give away. And
Mm,
we've got to get noisier, guys. We've got to get noisier. So I'll be sending out emails saying, look, make a video for World Hypnotism Day, and I'll be smashing it on social media like I did before. Okay. So otherwise, from that, Linda, thank you so much for joining in, and we'll
I've
catch
loved
everybody in
it.
the
Yeah.
future. Okay.
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 Bye
All right.
then.
See
Thanks so
ya.
much.
Bye.
Thanks.
Big love. Big love.